We are quite near to China, so we have to be very careful to monitor their any kind of emerging infectious diseases. And fortunately, our colleagues in Taiwan CDC, from this and the PTT, from the internet, they found an announcement in Wuhan on December 31st, based on our observation and that's a personal dialogue, and we found the situation is quite severe. And also at that time, we consider that the situation, that's in mid-January, the situation is really worse. And at that time, they already discussed about this, they are going to be to isolate the entire Wuhan city or not, in mid-January.
Okay.
So I think that's the situation, but I don't know why that World Health Organization did not take actions as quickly as previously for H1N1 or even for SARS. Okay. If we compare to this alert of this healthcare worker, I think the alerts did not send out to the public, and not even to the entire world. Once there's a patient or a cluster of the patient, you have to ask all their contacts, and then to follow whether this contact has to trace two things. One is their infection sources, and another thing is to follow whether the surrounding people have been affected. Not necessarily all the activities has to be stopped. So they can go to school, go to work, go to do any necessary work. But they have to reduce this so-called not so essential or not unnecessary recreation, go to recreation centers, go to for tourism and so forth. So I think that as long as people change their lifestyles and reduce their unnecessary social contacts, then the disease can be controlled quite well. But sometimes mass testing is not efficient and also not cost effective. So I think that there's something between the mass testing and that's designated testing. I would suggest that you have to test this on close contacts and for the first as a first priority, and then the high risk group. High risk group, I mean that healthcare workers and the cashier of the supermarket and drivers of public and transportation vehicles such as buses and taxis and so forth. I think that we won't get rid of this virus totally. It will stay with us. And if this is the case, then it's something like an H1N1 new influenza in year 2009. So we definitely have to prepare for as a long existence.